Hello, I'm Dr. Trivedi, a junior doctor in this medical ward. May I confirm that I'm talking to Mr. John Voigt, 74 years?
Yes, doctor.
Yes, Mr. John. I'm actually a bit I'm very sorry to disturb you at this moment, but may I have a discussion with you regarding your health issues and some management plans?
Yes, doctor. It's okay.
Yes, okay. And during our discussion, I might take down some notes, which will be strictly confidential. Will that be all right?
Okay, doctor.
Okay, Mr. John, before starting our conversation in details, may I know how are you feeling at this moment?
Truly speaking, doctor, I am feeling better, but it is not quite up to the level. I am
Ye-
better than the when I admitted to the hospital, but it is not quite good. And I am taking oxygen through my through this channel, but I think that I am not getting much more air, and I am still feeling shortness of breath.
Yes, yes. Well, actually, do you have any ideas that since your admission in the hospital this time, what happened and what have we done for you to make you better?
Yes, doctor, I have been admitted several times before. And after coming to the hospital, they gave me oxygen, some nebulized medication, and some injectable drugs. After that, I feel better. And this time, it is taking little more long time to feel better.
Yes. So, actually, would you like me to discuss some more about your condition now?
Okay, doctor.
Okay, and actually, we have reviewed your condition, and uh, we our consultant, chest physicians, all have checked and reviewed your condition, and actually, at this moment, we have found out that your disease condition. I guess you know about your disease condition. What is it?
Yes, doctor. The doctor said it is COPD.
Yes, yes. Okay, so actually, I guess you know some more or less about it. That it's a chest condition. Do you know
Yes,
about it?
doctor. Yes, doctor.
Yes, yes. So actually, since you have some idea, I would like just to add that actually it's a condition of the chest, and uh, there there is something sometimes a damage to the airways actually in this disease, and it is actually progressive. So as the day goes by, uh, the damage actually can increase. Okay, so you have already had some medical admissions, and this time, even after giving those medications, I'm sorry to say that your condition has not improved up to the mark. Are you getting me, Mr. John?
Yes, doctor.
Yes. And already since, as I said earlier, already our consultants have reviewed your condition, and they think that you might need some domiciliary oxygen. Have you ever heard of it?
No, but I
Okay.
take oxygen at home.
Yeah, yeah. So actually, may I know that for how long do you take this oxygen at home?
For about last 5 years.
Yeah, yeah. And for every day, for how long do you take this
Doctor,
oxygen?
every day about 20 hours. At least I am housebound person. I rarely go out. I
Yes, yes,
take
yes,
oxygen, and without that oxygen, I am breathlessness even at home.
yes, yes, yes. So you're already on it. So actually, our consultants also reviewed that this must be continued, but there can be some other issues. May I proceed, or would you like to know about it?
Okay, doctor.
Yes. So actually, already you have been extensive medication and extensive treatment for your disease condition, which is COPD. But actually, what we are suspecting, and I'm sorry to say that despite giving all those medication and all those treatments, uh, your condition may not improve, uh, improve significantly. Are you getting me, Mr. John?
Okay, doctor. Do you have
Yes. And
would do at this point if my condition doesn't improve?
yes, actually, there are several options at that time. Actually, COPD can at times go to a point that uh, the doctors cannot have so much option. Okay, but if it occurs that you get severely breathlessness, you develop severe breathlessness, then we might think of having some uh, some procedures to you. Are you getting me, Mr. John?
Okay, doctor. Getting it.
Uh, okay, well, would you like to know something more about it?
Yes, doctor.
Yeah, well, actually, if a patient's breathing gets very worse or grim, we medical team might go for an option named intubation. Have you ever heard of it?
No, doctor. What is it?
Okay, actually, in this case, we introduce a tube in your chest. Okay, and then link it to a device outside so that your breathing can be maintained. Are you getting me, Mr. John?
Okay, doctor. If you do that, will I be fine?
Well, let me get you actually. Uh, First of all, this procedure itself is not totally risk free. Okay, during this procedure, a patient can get worse at the beginning. Uh, uh, he may get infection or some bleeding as well, and the procedure might not be successful all the time. These are the facts, but at the same time, we do it because we can maintain the breathing and we get some opportunity to go on for some more aggressive treatment. But I'm sorry to say that even if we do this procedure, we cannot be totally sure that you will get fine. Are you getting me, Mr. John?
Okay, doctor. What is the chance of getting well with that device you said intubation?
Yes, actually, I'm sorry to say that although I don't at this moment know the exact percentage, but actually, even if doing this intubation does not actually increase your survival chance a lot. Okay, are you getting me, Mr. John?
Yes, doctor.
Yes, but it's true that it can make you keep you alive, and it can help you to keep you alive. And we also at that time uh, do to can try to give some more medication to help you. But we are not at all 100% sure that it will improve your condition. Are you
The
getting me?
bad side of it, doctor. You are saying that it has some bad effects.
Well, actually, I have to be honest with you that even if you do it, you cannot be totally sure of being well again. And at the same time, uh, suppose if you survive, which would be a very good news for us. Uh, After doing intubation, your quality of life might not be as well as before. Are you getting me, Mr. John?
What type of quality of life you are talking about?
Well, actually, this is a very what we tell an invasive procedure. Actually, this intubation and uh, this intubation can be quite this type of procedure can actually further worsen your lifestyle. You are already bed bound, and actually, in that case, your quality can further deteriorate. Your I'm afraid to say. Are you getting me?
Okay, doctor. Why are you then suggesting it?
Well, actually, uh, as a doctor, it's our duty to discuss all the treatment plans or all the treatment options with our patients. And although it can be difficult for a person like you at this, but actually it can sometimes be life saving. Okay, and as our doctor, it's our duty to tell you about the life saving
2 minutes
procedure,
remaining.
about the life saving procedures that are available to us. So that's why actually I'm telling you about this. Are you with me, Mr. John?
Okay, doctor.
Okay. Do you do you think that in that case you would like to give your consent to do, run with the procedure?
Doctor, you have seen a lot of patients like me, and I am not even quite clear sure about this procedure. Do you have any suggestion for me? Should I go for it or not?
Well, actually, uh, the decision will completely lie upon you. I should. Our we doctors are here to help you, but the decision should be yours. Okay. But as I have told you, that there are both bad sides and good sides behind it. And even if you don't agree to be intubated, you should not be afraid, because we will be very cautious about your health, and we will try to ease your life in that case also, as much as possible through medication and other probable plans. Are you getting me, Mr. John?
Yes, doctor. But doctor,
So
honestly, what would you do if this was in your situation?
well, actually, it's not mine to say, but I actually it's actually totally your decision. Okay. So and it's not, it's legally it's not wise, and it's not right for me to tell about my decision in that case. Okay, it is completely your decision, and you are free to take any decision. Are you getting me, Mr. John?
Time up. Okay. So what was the task?
uh, my task was to get opinion, if he wants intubation if current condition gets worse.
Okay, and what do you think?
uh, well, I think I told him about the pros and cons about intubation, and he was, I don't think whether I could actually make him reach a point just at this single meeting.
What do you
uh,
think? You could have explained him well about intuition.
I don't know actually what more could have done. I have no so much idea.
Okay, I am coming to the scenario. Okay. So what condition or what was given in the scenario state?
Well, one thing is that
Can you
he
say about the patient's condition?
well, he already, actually I had a confusion while reading this stem, because he here needed, it was told that he needed domiciliary oxygen therapy and his COPD was severe. From this line, actually I was not sure that whether he was already getting that domiciliary oxygen, or whether it was proposed now that he needed domiciliary oxygen. So that was a bit confusing for me at that moment.
No, it is written. Now he is on supplementary oxygen therapy.
Yeah. So now I was not sure that now supplementary means after getting admitted or not.
Yes,
So
it is given. This gentleman was admitted to exacerbation, nebulized.
so now
Now
yeah. So
he is
now it's
on.
getting supplementary, but in the next para, it was given
He
that.
needed oxygen therapy or domiciliary oxygen therapy. That is home oxygen therapy. Domiciliary means
Yeah. So I
home
was not
oxygen
sure
therapy.
that whether he is already getting home oxygen therapy, or now it is decided that he needs oxygen therapy. So I was not sure at this moment actually. Okay.
How we
So
have confused it. He needed domiciliary oxygen therapy. It is written that he needed domiciliary home oxygen therapy, and his COPD was severe. It is his COPD, and it is written that acute exacerbation of COPD. That means this patient was diagnosed COPD a long time ago.
yeah, it's my fault actually, but I couldn't get it at the beginning. Okay. So
Actually, at that point, you could have asked the patient. You haven't asked him.
yes. That's another wrong thing. Okay.
Okay. I'm coming to your points that first you have introduced yourself well, then you have asked the patient how he is now. Okay. Then you should have asked about him that what, how far do you know about yourself? Okay.
Mm,
Then
mm,
he would say that, okay, this morning I had some shortness of breath, suddenly aggravated, and at the time I came to the emergency department. They admitted me, they gave me some
mm,
nebulization, some oxygen, and some other medication through my blood sample.
mm, mm,
And that was fine.
mm, mm,
Then you should have asked that, okay, is it okay to discuss about our further management plan with you?
mm,
And okay, then the patient would say, okay, you can do it.
mm,
After that,
mm,
okay,
mm,
and that how was your home management, or what was your home management? That is, you are going to giving him intubation. Okay, so
mm,
you should have asked about his uh, quality of life before the disease. Okay,
mm,
so you are asking his quality of life before the disease, before this admission. You haven't asked it.
mm,
About
mm,
quality of life.
mm,
Okay,
mm,
after quality of
mm,
life, then okay,
mm,
you are. I can understand that you are not even improving much with this current treatment. Do you have any idea what is our next step of management in this stage or in this type of patient? Then you would say, okay, I don't have any idea.
mm,
Then you would say, okay, in this stage, at this stage, if patients are not improving with this medication, then he needed
mm,
some machine support for his breathing.
mm.
Do you have any idea of that, or do you want me to tell more about that? Okay, then he would say, okay, okay, okay. Uh,
Mm,
then he would say, okay, tell me. Okay, at that time give uh, we
mm,
give you some medication. Okay,
mm, mm,
we introduce a tube through your mouth,
mm,
and that is attached to the another machine. Okay,
mm, mm,
and that will give you the support for your uh,
mhm, mhm,
breathing. Okay, at
mhm,
that time
mhm,
patient say, okay, tell me more about that. Will I be conscious during that time, or will I be unconscious? Okay,
mhm,
uh,
mhm.
after that, okay, and
What should I tell that then?
okay, intubation. In intubation, mechanical artificial ventilation, it is patient is remain unconscious.
Mhm,
Patient is remain on medication. Okay,
mm, mm,
it's not
mm,
any BiPAP or CPAP. It is intubation means
mm,
you are giving him, you are sending him to the ICU, and
mhm,
there he's giving getting mechanical ventilator support. Okay,
mhm, mhm,
and during
mm,
that time, your breathing will be maintained by this machine. Machine
mm,
will maintain your oxygen. Okay, I
mhm,
know this part. Do you have any question till now? No.
mm, mm,
And after that, after that, what will and your condition? Yes, you have some problem. Your condition. I'm sorry to say that your condition at home was not so good, and we cannot guarantee this that this intubation or this artificial machine support will improve your condition or will recover you from this. We are not quite sure
mm,
whether it also
mm,
have some disadvantage also. So if you like, I can tell you the disadvantages of them. Okay.
mhm, mhm,
What is the
mm,
disadvantage? Okay, after during intubation of tube, some patients may get some bug infection into their chest, so they can uh, their
mhm,
condition may deteriorate worse very rapidly. But we have good management team, and it is unlikely to happen. Okay,
mhm,
and
mhm.
during that intubation, there might be some injury to your windpipe.
Infection, bleeding, injury.
Yes, that can also uh, give you some. discomfort, or that can also deteriorate your condition. But we again we are telling that we have good supporting team, and this is less likely to happen. Even after removing this tube, there might be some scar in the windpipe that that after recovering from this type of treatment, patients frequently get some cough, pain in their throat, get extra shortness of breath due to the scarring. Okay, you will say, okay, I can understand now the good side and bad side. And is there any other management option? Is there any other management? Then you could say, okay, as we are giving you the most uh, therapy, giving you the best therapy that is that can be done on the ward, and you are all that, and I am sorry to say that you are not quite up to the level. But at this point, I want to ensure that we are not going to do that immediately. We are just asking you if your condition get worse, if you want us to go for that or not, so that we are discussing this. Then okay.
Okay.
And we'll say, or otherwise you will ask that, may I know other thing from you? Okay. Have you ever appointed anyone for your lasting power of attorney so that he can decide in this situation? Like if you cannot decide on your situation, you what treatment should be given, what not to be given? No. Okay.
Yeah.
Then okay, we are
Custom power or another I just forgot. Custom power of attorney or advance directive.
advanced directive. Okay, you will say yes or no. Whatever he says, we will proceed on that. Okay, after that we will ask. Okay, do you have any question for me? No. Do you have any concern? No. Okay, I am. You can take your time. We are giving you the best management plan, and in the time we are also asking this in advance. If in this case, if we need help, if we need that, you can take your time and you can ask if you have any question, and then you can give us opinion for that, and also you can withdraw the consent at any point.
Okay.
And also that is another thing, that whenever he asks that what do you suggest at that point, okay, we are here to explain everything, pros and cons and everything about the procedure, and after that you should take the decision on your own, and we suggest you not to take decision according to your family members or according to any other else, including me. And since your opinion, you should take the decision on your own. And if you need any information with that, then we can always provide that. Okay.
Yeah, that was it. I did so many wrong. Okay.
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 At this point, your task was you have missed a bit because you haven't asked about more about patient's condition before the quality of life. Before quality of life was his quality of life before intubation. Patient was taking domiciliary oxygen. Patient was housebound, and also patient have a recurrent exacerbation. And with that, even after getting coming out from the intubation, even he develop again. He have already have this problems, and with that he will develop again some pain in the throat, some coughing, and again extra some shortness of breath. So that will be very difficult for him. So he may tell, no, I don't want to, I cannot suffer more than this, so please do not go for that.
Yeah.
He can say or not. Okay.
Okay. Yeah. Yeah. Okay.
Do you have
Okay.
anything to add?
No. No. So I think that's enough for this case.